Hello and welcome to the Nurse Station. My name's Maria Mobley, and this might be one of the most important things I teach you. I need you, the first day in clinical, to know what to do if this situation happens. The first day of when I have my clinical group, I go into a room and we walk through what do you do if a patient appears unresponsive, okay? So I need this to be ingrained into you. It needs to be second nature. You will never have all the answers. I will never have all the answers, but this keeps patients safe, okay? So the nurse walks into the room and the patient appears unresponsive. This is very important. You've only visually inspected and it only appears they're unresponsive. You have to gather more data first to determine what you do. Don't just start CPR. They could just be sleeping, right? So what do you do if a patient appears unresponsive? What action do you take first? If you are in the clinical setting, there's no way you have not taken basic life support, right? That's a part of being able to do clinicals. So this is something that you have been taught, but we need to understand why, and we need to do it second nature, okay? Scene safety does not change. I know y'all are thinking, oh, we're not gonna get hit by a car. Like, I'm not dragging somebody out of the road that had a motor vehicle collision. I get that. But you have to consider safety before you go into a patient's room. One of the biggest things I think of is isolation precautions. You can't run into a patient's room that appears unresponsive, for instance, if they are on airborne precautions. You still need to don appropriate PPE. So please don't forget this step. That is step one. This is a great put in order of priority question. And I use it for my students all the time because this needs to be ingrained in us. This keeps patients safe. So don't forget scene safety, but think about what that looks like in the hospital or healthcare setting, regardless where your clinicals are. And then next, you assess the responsiveness of the patient. This is gathering data. This is not an action. I know we're physically doing something, but in your nursing process, this is the assessment. We are trying to see, hey, what type of responsiveness does the patient have? Now, don't say shake. My students always say shake the patient. No, we don't want to ever use that shake word, but what it's called is tap and shout. So you're going to make sure you don appropriate PPE, do whatever you need to do to keep yourself safe in that patient's room, and you're going to go in and you're going to tap and shout. And I'm just going to walk through an adult patient. You need to know the differences with infants and children. But when you tap and shout, I need you, I did this wrong for years. I don't even know when the evidence changed, but you need to tap and shout on both sides of the body, right? What if you tap and shout on one side only and they have a neurological deficit, or they are post-stroke and they have no sensation on that side, right? I need you to tap and shout on both sides of the body, and then how they respond is how you act. So I tap and shout on this patient and they respond. They immediately wake up. They were sleeping, right? It could be so many things, but they respond. If they respond, you start a primary survey. And how they respond, right? There's a very quick acronym, AVPU, that we use very quickly. Are they alert? Do they respond to verbal stimuli? Do they respond to painful stimuli, or are they unresponsive? So that's something I can quickly use to assess responsiveness, but they respond, and your patient responds, verbal response after painful stimuli, and now they have new onset confusion. That's just an example. You need to start your primary survey, A, B, C, D, E. If you don't know what this is, I have a great video that walks you through it. But you assess the airway. If you have an airway problem, you fix that before you go on to breathing. If you have a breathing problem, you fix that before you go on to circulation, okay? So you need to do A, B, C, D, E, and get help if indicated. If your patient pops right up and was just sleeping, you don't need any help. But that patient that only respond verbally to painful stimuli, you need to start doing a detailed primary assessment, and you may need to get help depending on what assessment data you gather. Now, on the opposite end, you tapped and shout on both sides of the body and they were unresponsive. You, number one, activate the emergency response. If they do not respond to you, you need help in that room. In your clinical settings, you need to go into the room and find the buttons that you need to identify. We have code blue buttons. We have emergency response buttons. Find it in your room and get comfortable. If I need to get help into this room, how do I do that? So make sure you identify, they're different in every setting. How do you get help in the room? So activate the emergency response, assess. You're gonna assess breathing and pulse. So you are looking for chest rise and fall, even if it's only gasping, right? We want to see if they have breathing. And on an adult client, you are gonna assess their carotid pulse on the side of the neck closest to you for up to 10 seconds. If you do not feel a carotid pulse for up to 10 seconds and you do not identify breathing, or if it's gasping only, you need to initiate CPR using CAB, all right? So when you initiate CPR, you do not head tilt chin lift, and you do not start with airway and breathing first. You jump on their chest and start with high quality compressions. This is very important. This is evidence-based practice. And when somebody's in cardiac arrest, they need blood to flow. Compressions is what initiates blood to flow. So again, you assess no breathing or only gasping. You assess a carotid pulse on an adult patient. You feel no carotid pulse up to 10 seconds. I need you to start CPR with compressions first. This is your acronym. Compression first, then airway, then breathing, okay? Do not start with the airway. That, again, wonderful put in order priority question. I use it all the time, all right? And again, this is just a quick reminder of what to do, but I encourage you, just get help. If anything, if you can only remember to get help in the room, you've done something. But this should be ingrained into us as healthcare providers. I hope this helps. I hope you look at your room and identify all the tools you need to keep patients safe. As always, if this helped you, please help somebody else. Take care.